Brain tumor. A brain tumor is a mass or development of strange cells in your cerebrum. Various sorts of mind tumors exist. Some cerebrum tumors are non-cancerous, kind, and some brain tumors are dangerous, threatening. Cerebrum tumors can start in your brain, essential brain tumors, or disease can start in different pieces of your body and spread to your cerebrum, auxiliary, or metastatic, cerebrum tumors. How rapidly a cerebrum tumor develops can shift extraordinarily. The development rate just as area of a cerebrum tumor decides what it will mean for the capacity of your sensory system. Cerebrum tumor treatment choices rely upon the sort of mind tumor you have, just as its size and area. Side effects. The signs and side effects of a brain tumor differ incredibly and rely upon the cerebrum tumor's size, area and pace of development. General signs and manifestations brought about by cerebrum tumors may include new beginning or change in example of migraines. Migraines that progressively become more successive and more extreme. Unexplained queasiness or heaving. Vision issues, like obscured vision, twofold vision or loss of fringe vision. Continuous loss of sensation or development in an arm or a leg. Trouble with balance. Discourse challenges. Disarray in regular issue. Character or conduct changes. Seizures, particularly in somebody who doesn't have a background marked by seizures. Hearing issues. When to see a specialist. Cause a meeting with your PCP in the event that you to have relentless signs and indications that worry you. Causes. Cerebrum tumors that start in the mind. Essential cerebrum tumors begin in the actual mind or in tissues near it, for example, in the mind-covering layers, meninges, cranial nerves, pituitary organ or pineal organ. Essential mind tumors start when ordinary cells get mistakes, transformations, in their DNA. These changes permit cells to develop and partition at expanded rates and to keep living when sound cells would kick the bucket. The outcome is a mass of unusual cells, which frames a tumor. In grown-ups, essential mind tumors are significantly less regular than our auxiliary cerebrum tumors, in which malignancy starts somewhere else and spreads to the mind. Various kinds of essential cerebrum tumors exist. Each gets its name from the kind of cells included. Models include gliomas. These tumors start in the mind or spinal line and incorporate astrocytomas, ependymomas, glioblastomas, oligoastrocytomas and oligodendrogliomas. Meningiomas. A meningioma is a tumor that emerges from the films that encompass your cerebrum and spinal line, meninges. Most meningiomas are non-cancerous. Acoustic neuromas, schwannomas. These are kind-hearted tumors that create on the nerves that control equilibrium and hearing driving from your inward ear to your mind. Pituitary adenoma. These are for the most part benevolent tumors that create in the pituitary organ at the foundation of the cerebrum. These tumors can influence the pituitary chemicals with impacts all through the body. Medulloblastomas. These are the most widely recognized harmful mind tumors in kids. A medulloblastoma begins in the lower back piece of the cerebrum and will in general spread through the spinal liquid. These tumors are more uncommon in grown-ups, however they do happen. Germ cell tumors. Germ cell tumors may create during youth where the gonads or ovaries will shape. Yet, once in a while germ cell tumors influence different pieces of the body, like the mind. Craniopharyngeomas. These uncommon, non-cancerous tumors start close to the cerebrum's pituitary organ, which secretes chemicals that control many body capacities. As the craniopharyngeoma gradually develops, it can influence the pituitary organ and different constructions close to the cerebrum. Malignancy that starts somewhere else and spreads to the cerebrum. Optional, metastatic, cerebrum tumors will be tumors that outcome from malignant growth that beginning somewhere else in your body and afterwards spreads, metastasizes, to your mind. Optional cerebrum tumors frequently happen in individuals who have a background marked by malignancy. Yet, in uncommon cases, a metastatic mind tumor might be the principal indication of malignancy that started somewhere else in your body. In grown-ups, optional cerebrum tumors are definitely more normal than our essential mind tumors. Any disease can spread to the mind, however regular sorts include bosom malignancy, colon malignancy, kidney malignancy, cellular breakdown in the lungs, melanoma. Risk factors. In the vast majority with essential mind tumors, the reason for the tumor isn't clear. In any case, specialists have recognized a few factors that may build your danger of a cerebrum tumor. Risk factors include openness to radiation. Individuals who have been presented to a kind of radiation called ionizing radiation have an expanded danger of cerebrum tumor. Instances of ionizing radiation incorporate radiation treatment used to treat malignancy and radiation openness brought about by nuclear bombs. Family background of mind tumors. A little part of cerebrum tumors happens in individuals with a family background of mind tumors or a family background of hereditary conditions that expansion the danger of brain tumors.